Bismillahirrahmanirrahim. Dear fellow students and colleagues and those who are appearing in the postgraduate examination and those who are appearing in the third year and the final year examinations. Now actually we were discussing the infection and disease, infectiology. The subject is infectiology, and this is a big chapter because there are a lot of diseases which are related with the microbiological agent. I think it is more than 60 to 70% are the diseases comprising a huge amount of the diseases which we learn. But problem is this, actually we learn the disease from the book or from the lecture or from the internet and forget it. Second point which I want to tell you is that you should not refer any internet references via Google search engine or other search engine to any examination. Otherwise they are not authentic and you will not gain the marks. If you will refer to the textbook of the medicine, then it's okay, it's fine. But these are the actually bacteria which we are learning. Bacteriology, this is clinical bacteriology. And I have reached all of the cocci, and now want to discuss the bacilli. The bacilli again is divided according to the stain into gram-positive bacilli and the gram-negative bacilli. Gram-negative are concerned, a lot of bacteria are there. As far as the gram-positive bacteria, they are few in number, which are injurious to the human. And they are Cornybacteria, for example. Bacillus anthrax, Leptospira, and a very important bacterial group which is called Clostridium. These are the bacteria. Secondly, the gram-positive bacteria are important in the very common problem which you have. Two types of the problems. One are the food poisonings. Secondly, the localized or focalized infection of the skin. They are also important regarding this. Regarding this Cornybacteria is concerned, one thing you know is the Cornybacterium diphtheria, that is. But there are all other diseases which are related with the Cornybacteria. So I am Professor Sayyid Ali Hadar. I am representing as visiting Professor of Medicine, Jinnah Sindh Medical University, Karachi. I am trying to refresh your knowledge, that's all. No new thing. How many cases of diphtheria have you seen in your life? This is my question. Like smallpox, I have not seen any case of smallpox after my graduation. Or before my graduation, 1974 to 1982, I have not seen it. But I have seen the cases of diphtheria in 1975, 76, 77. And this is one of the very important differential diagnoses. As the bacteria is concerned regarding diphtheria. The Cornybacterium is a genus of gram-positive bacteria and they are mostly aerobic. They need some oxygen. Rather, amount of oxygen should be more. They are bacilli and they are rod-shaped corniform type, club-shaped type. That is what they are called Cornybacteria because of the shape. They are widely distributed in the nature as the commensals also, and there are more than 100 species of the Cornybacteria which are affecting the animals, means human also, and are mostly innoxious, most commonly existing in commensal relationships with their hosts. Commensals are the bacteria which are neither beneficial nor they are harmful to the body. Commensals. Some, such as Cornybacterium, glutamicum, are commercially useful. They are useful in the industry, in the different type of the making of the foods are concerned. But the animal foods or the human food, some of them, they culture it and they are beneficial. Other can cause human disease, including most notably the diphtheria, which is caused by the Cornybacterium diphtheria. As with various species of the MICROBIOLOgy, that is, this is the genus of this Cornybacterium, including the relatives in the genera, that is the Cornybacterium and the Diptherae. They are usually not pathogenic, but can occasionally opportunistically capitalize on atypical cases as atypical access to the tissues through wounds or weaken the host defenses. So the localized and focalized infection occurs. I already said that these bacteria are not only causing the problem regarding the ENT is concerned, they are important in the localized skin infestations, infections. Now this is the shape like just like this. Positive bacteria, therefore they are. Color is purple shaped, violet color, positive, baseless, not like the bar, but it is club shaped. Very beautifully demonstrated under the high powered microscopy. They occur in the three triplets or diploforms also, just like the meningococcus or the gonorrhea, as far as the gonococci are concerned. Now, clinical microbiology is concerned, they are catalase positive, non-sporing, they are non-motile, rod-shaped bacteria or club-shaped bacteria that are straight on, slightly curved. That is why they are corniform. Metachromatic granules are usually present, representing the stored phosphate regions. Their size falls between 2 to 6 micrometer in length and 0.5 micrometer in diameter as far as these granules are concerned. These are important as the pathogenicity of the bacteria is concerned. The bacteria group together in the characteristic way which has been described as the form of a V parasite or Chinese characters, as we see in the previous slide, just like this. Letters are like this. Palisade grouping one in a straight line, or like the Chinese letters, like this. Yes, and this one, this one. They may also appear elliptical and they are aerobic or maybe facultative anaerobic, and it is a chemoorganotrophs, meaning that the chemical agents can definitely gratin them. They are pleomorphic through their life cycles. They occur in the various lengths and they frequently have thickenings at their end depending on the surrounding conditions. Now, some cornybacteria are lipophilic, and there are many of them. Corniform groups like F1, GC, or Cornybacterium accumbens, or Cornybacterium aftermentans, etc., bovis, Jackium. These are the other species which are described here. A lot of them. only one is very important, is the Cornybacterium diphtheria in humans. Human is concerned, the Cornybacterium diphtheria is the most important coliform bacteria. The cell wall is distinctive in the Cornybacterium with a predominance of the mesodiamino pimetic acid in the murin wall and many repetitions of the arabinogalactans, as well as the corneomycolic acid, mycolic acid with 22 to 26 carbon atoms bounded by the disaccharide bonds. They are called the L-RAP 124 DG1C NSC phosphate. Do not remember, but the wall is distinctive wall. They have got the metachromatic granules, as I said already, and this causes the specific pathogenicity of this organism causing the diphtheria. These forms are complex, commonly seen in the Cornybacterium species, and mycolic AG peptidoglycan. Unlike most Cornybacteria, the Cornybacterium Cornybacterium cetalide does not contain the mycolic acids. So, because they are important in animal species, these bacteria, Cornybacterium, Cornybacterium or other bacteria of Cornybacterium, the only one which we are actually looking for importance for the human is the Cornybacterium diphtheria. Why it is very, very important pathogenic organism? This is which I want to tell you is this, because of the wall is distinctive, because they have got chromatic granules, and their wall also consists of mycolic acids. Remember, these acids staining reaction is important with this substance, mycolic. Remember, they release their antigenic properties with the cell walls. Endotoxemia is important in this case. If the wall ruptures and releasing these mesodiaminopic acid, murine, and mycolic acid, etc., they are generating the endotoxins, and these are the pathogens. This is the pathogens, exogenous pathogens. They act as an exogenous pathogen. They cause fever in the person. If you culture it, very slowly cultured in the enriched media, nutritional requirements all need biotin. This is vitamin B to grow. It needs biotin. Some strains also need thiamine, vitamin B1, and para-aminobenzoic acid, which is definitely you know about it. It is an amino acid. Some of the Cornybacterium species with the sequence genomes have between 2.5 and 3 million base pairs. The bacteria grow in the Localisation medium, specific media, blood agar and the triticase soya agar, TCA that is called. If you want to culture it, you culture on this media. This is the best medium. That is Localisation medium. They form small grayish colonies with a granular appearance, mostly translucent, but with the opaque centers, convex with continuous borders. The color tends to be yellowish-white in Localisation medium, but in the TSA they can form grey colonies with the black centers and dentated borders that either resemble flowers, continuous borders, or a mix between the two forms. So different type of the species will cause the different type of the colonies. It means that. But they need biotin to grow. Some strains need thiamine and para-aminobenzoic acid. So you add in this media, Localisation media. Now this is what they described it. It is the Cornybacterium diphtheria. The colonies are describing here in the high microscopic fields and the low microscopic fields. Just like this. They are emerging just like a flower-like appearance in the colonies. Now about the clinical feature of cancer, the most notable human infection is diphtheria caused by the Cornybacterium diphtheria, It is an acute contagious infection characterized by the pseudomembranes of the dead epithelial cells, white blood cells, red blood cells, and fibrin that form around the tonsils, and that is called pseudomembrane, and back of the throat. In the developed countries, it is an uncommon illness because of high vaccination. They tend to occur in the unvaccinated individuals, especially school-aged children between 3 years onwards. The elderly, neutropenic or immunocompromised patients and those with the prosthetic valves devices such as the heart valve or shunts or catheters, they are prone to develop and they aggregate there and cause the illness. The children are at risk, the elderly at risk, the neutropenic at risk, immunocompromised, either HIV or non-HIV patients, they are at risk. And those that have got a prosthetic metallic heart valves, I would say, they are at risk. It is more common in developing countries. It can occasionally affect the wounds. This is important because there are injuries which are going on in the city by motorcyclists. Mostly they are motorcyclists or rickshaw drivers. They are causing these injuries. It is infected by this Cornybacterium, Diptherae. If it is, then definitely the infection is very, very important. It can infect the vulva and conjunctiva and the middle ear also because ENT, and eye is involved. It can spread from within the hospital. It is a nosocomial, which means that. It comes under the nosocomial infection. The virulent and the toxigenic strain produce the exotoxin formed by the two polypeptide chains. Now, the endotoxin I have already discussed. But as far as exotoxins are concerned, these are the polypeptide chains, metachromatic granules, which I have said previously. They are forming it, which itself produced within a bacterium is transformed by the gene from the beta prophage. A gene which is called the beta prophage is actually transformed, the characteristic property of the Cornybacterium. Now, several species cause disease in animals, most notably the Cornybacterium pseudotuberculosis. This will be asked by examiner, I remember in 2016, for the Cornybacterium pseudotuberculosis. So he said that, can you have any idea about this thing? About tuberculosis, he was discussing tuberculosis actually, and then he said that anything about that pseudotuberculosis. And the candidate didn't know about anything like pseudotuberculosis. He said that pseudotuberculosis means that it is other mycobacteria which are affecting the person. But this is not the correct answer. The answer is the Cornybacterium pseudotuberculosis, which causes the caseous lymphadenitis, just like the caseous lymphadenitis, which is commonly seen with what in tuberculosis. The caseous lymphadenitis or lymphadenopathy occurs in tuberculosis. It can occur with the Cornybacterium pseudotuberculosis and in nodular sclerosis of Hodgkin lymphoma. So there are three differential diagnoses. At that part, which he was discussing, because there was a lymphadenopathy in that long case, and he said that it is method lymphadenopathy, meaning caseous lymphadenitis. So he said that it is tuberculosis, most probably. Yes, of course. He said, do you know what about the pseudotuberculosis? He doesn't know about it. One is pseudotuberculosis is from the bacteria, which is Cornybacterium tuberculosis, pseudotuberculosis. Another one is nodular sclerosis from the Hodgkin lymphoma. Now, some attack healthy hosts, while others tend to attack the immunocompromised. Healthy hosts mean that the people who have got no immunity is still lacking in children, actually. Effect of the infection include the granulomatous lymphadenopathy. It can cause pneumonitis. It is not pneumonia, it is pneumonitis, inflammation, of the terminal lung tree, that is the beside the the alveolar bronchus and bronchi connecting to it, and the about the alveolar spaces, they are infected. Pneumonitis, nephrologitis, skin infection, and endocarditis. Some attack healthy hosts. Now this is important, which is endocarditis is concerned, because 2 to 3% of the endocarditis occur with the Cornybacteria. Now, Cornybacterium endocarditis is seen most frequently in patients with intravascular devices. You put it inside, for example, the venous filters, or if the mechanical heart valves, and you put some other devices like stents, etc. If they are infected, it's called endovasculitis, that is. So it is important. Cornybacterium diphtheria can cause this also. Several species of Cornybacterium can cause the trichomycosis axillaris. This is a skin infection. And Cornybacterium striatum may cause the axillary odor. You see the odor in the axilla because of the proliferation of the Cornybacterium striatum. It should be remembered by you. Please remember it. Those people who have got a very odor, high smell from the axilla because of the hair were not removed properly and the hygiene was not properly practiced, then this causes the odor, specific odor. What is it? People don't like it because of the collection of the the fluid that is it is. Another one is the collection of the fluid under the tummy, which is called minutizium, which is called erythema or intertrigo. It can cause erythema or intertrigo, where the skin folds are there and the collection of the sweats there. The sweat in the axilla is caused by and causing the odor is Cornybacterium striatum, while as far as the intertrigo is concerned, or erythema, the Cornybacterium minutizium. Those who are appearing in the foreign examination, MRCP, they should remember these Cornybacterium striatum and Cornybacterium minutizium. Now, minutizium, these two bacteria are important as far as the dermatology is concerned, because they ask dermatology. In MRCP examination, 20%, 30% of the MCQ they are depending on this. I don't know why. Now, coming to record about this very important product that is called diphtheria. Epidemiology is that it is fatal in between 5 and 10% of cases because of detachment of the pseudomembrane and its epiglottitis, and it will block the trachea. In children under the 5 years and adults over 40 years, the fatality rate may be as much as 20% at one time. I have seen these 3 or 4 cases of diphtheria in my life. In 2013, it resulted in 3,300 deaths, down from 8,000 deaths, because of the vaccination program and because of the better hygiene. In 1990, it is 8,000 deaths in 1990. Now it reduced to 3,300 deaths. Better standard of living, mass immunization, improved diagnosis, prompt treatment, and more effective healthcare have led to a decrease in the cases worldwide. So EPI programming launches this, of course, extended program of immunization. UNICEF launched this program. The DPT, after the age of 1 month, you have to give, and then again there are booster doses, and again there will be a booster dose. The third booster will not contain the pertussis, although the third one, but D and T. And that is the important problem is this. So tetanus and It is diphtheria, polio vaccine, and tetanus. Diphtheria is a whooping cough. It's causing a whooping cough, and it is also called pertussis, polio, and tetanus. So these are three triple vaccination which is going on and going on and going on. Only diphtheria will be reduced up to the third dose, and only you will give the tetanus and the polio vaccine to the older children. The portal of entry is usually spread between the people by direct contact or through the air, droplet infection. It may also be spread by contaminated objects, wounds, motorcycle accidents, or rickshaw accidents, usually in Karachi. It is the portal of entry. Some people carry the bacterium without having symptoms, but can still spread the disease to others. Infective in nature. The three main types of the Cornybacterium diphtheria cause different severities of the disease. The symptoms are due to the toxin. It is the exotoxin produced by the bacterium. Diagnosis can often be made based on the appearance of the throat and confirmation by microbiological culture, which is in the lopsidal medium, will be applied and see directly the club-shaped bacteria under the microscope, or if you culture it, the Chinese letter of flower-shaped type of the colonies are seen. The previous infection may not protect against infection. As the infection is concerned, once it occurred, it means that the the recurrence is not possible. No. Here in this case, the recurrence is possible. You have to vaccinate by exotoxins. You have to give a specific vaccination to prevent the child from the recurrence. The presentation is an infection caused by the Cornybacterium diphtheria. Most infections are asymptomatic or have a mild clinical course in 80% in an upper respiratory infection. But in some outbreaks, more than 10% to 20% of those diagnosed with the disease, they may die. Why? Because of the formation of the pseudomembrane in the tonsil area, or asthematophysis, or in the pharynx. Detached membrane will plop down that is in larynx, rama glottidis, and in this fashion there is strangulation occur, and there is no way of oxygen to enter, and the child dies because of the detachment of the membrane, and it is definitely blocking the upper respiratory tract, trachea. Signs and symptoms vary from the mild to severe and usually start 2 to 5 days after exposure. Even incubation period is about 4 days, roundabout. Symptoms often come on fairly gradually, beginning with a sore throat and fever. Yes. In severe cases, a grey or white patch develops in the throat. Do not confuse with the another problem, which is the whitish in color, usually seen in the throat. That is the moniliasis, candidiasis. It is a pseudomembrane. If you detach this by forceps, it will bleed. But if you touch the candidiasis, it will not bleed. It is sticky in nature. You cannot detach it properly. The neck may swell in part due to the enlarged lymph nodes, Cornybacterium diphtheric lymphadenitis. A form of the diphtheria which involves the skin and eyes and genitals also exists. There is another species which is of the diphtheria, which involves the skin, the eyes, genitals. They are also, because of the bacteremia and because of the toxemia, they cause the myocarditis, inflammation of the nerves. They can involve the kidneys, as far as kidneys are concerned. They can cause acute pyelonephritis and bleeding problems due to the low levels of platelet, because directly they are affecting on the megakaryoblast and indirectly from the hyperesplenism. The myocarditis may result in the abnormal heart rate It may be definitely tachycardia followed by the bradycardia, and inflammation of the nerve may result in paralysis. The important is the polyneuropathy. I have seen one case of the polyneuropathy because of the diphtheria. I have seen 2 or 3 cases of myocarditis in my life, 47 years of my practice. That is myocarditis leading to the afterward the dilated cardiomyopathy. Polyneuropathy is seen by me in only once in my life. Polyneuropathy 2 to 3 cases. As far as the endocarditis is concerned, I have seen 1 or 2 cases. It was not diagnosed by me. It is a case presentation which is going on in NICVD. That is they cultured it and they found that it is a Cornybacterium. Now this is a diphtheric baby, swollen neck, flushing, very high respiratory rate here. The seen site, then you find the pseudomembrane. Usually the symptoms of the diphtheria 2 to 7 days, 4 days is the incubation period. They have got the fever of 100.4 degree Fahrenheit or above it, with chills, fatigue, bluish coloration, cyanosis because of the deficiency of oxygenation, sore throat, hoarseness, cough, headache, difficult swallowing, painful swelling. Very painful condition. Difficulty in breathing because of the swelling of the larynx, and rapid breathing, foul smelling because of bad mouth hygiene. There is putrefaction is going on in the mouth, and blood stained nasal discharge because it's also eroding the nasal mucosa. So epistaxis can occur, not because of any blood disorder, because of the localized infiltration of the diphtheria. And they will cause what is called as lymphadenopathy. It is Cornybacterium lymphadenopathy. It is painful lymphadenopathy. Afterwards, if it is caused by the Cornybacterium pseudotuberculosis, it can cause caseous type of the lymphadenopathy. I already mentioned it previously. Within 2 to 3 days, diphtheria may destroy the healthy tissue in the respiratory system. The dead tissue forms a thick grey coating that can build up in the throat or nose. This thick grey coating is called pseudomembrane. It consists of the bacterial growth and the cell debris, damaged necrotic tissues, the dead WBCs, and the fibroblasts which are coming now to patch it up. It is forming a pseudomembrane. It can cover tissues in the nose, remember, tonsils, larynx, and throat, making it very hard to breathe them. That is swelling so much. And because of the posterior pharynx is involved, very near to the esophagus, it is the painful swelling. You know that this is odynophagia. Symptoms can also include the cardiac dysarrhythmias, which is a subject of mine actually. Myocarditis, leading to the dilated cardiac myopathy, and the cranial and the peripheral palsies. Cranial nerves are concerned, 3rd nerve important, and 7th nerve is important. But 8th is seen by me also. And the peripheral neuropathy. I have seen one case of the peripheral neuropathy with the Cornybacterium. And this is the characteristic pseudomembrane. Take the tonsillar fossa. If you want to detach it, it will bleed. You can detach it, but it will bleed. If it is removed by deep inspiration or detached, it will clog out here, pack the posterior pharynx and the epiglottis and down there. So there will be definitely in this way the patient will cough and cough and cough. In the last bout of cough, there will be a great whoop. That is a whooping cough. That is whoop. Actually, this whoop is at the end of the coughing session. This is whooping. The whooping means this. of the session. Stridor is there, of course, in this case. Because of the glottis is very, very small, that is very, very small. The patient try to expire or inspire. So it will, a musical type of a problem which is going on around it, very, very forceful outlet and inlet is there. It will cause the stridor, croup, that is called. Myocarditis occurs because of the toxin-mediated complication and after 1 week of the onset of respiratory illness. If somebody gets diphtheria, it can cause the cardiac problems. It includes the cardiomyopathy and myocarditis, endocarditis. And the very important thing is that it will cause the what is known as the blocks, heart blocks. Early administration of the anti-diphtheric ADS in patients with the clinical diphtheria before the onset of myocarditis is of utmost importance to prevent, because you have to give the anti-diphtheric serum. If you see anything, you know that it may be possibility of diphtheria in this patient, please give the ADS at once. They are available in Cosser Medicos and in the Time Medicos. If you write it down, they will provide you in 1 day. And this is the complete heart block. Bradycardia, after the involvement of this system, you know that, and the sinoatrial node, and then you go to the AV nodal system. This is blockage is there, edema of the myocardium, and that is causing the slowing. Here the rate is about 40, 42, and it is the symptomatic bradycardia, and AV dissociation is there because there are two P waves. P waves comes one here, and definitely it is what is called AV dissociation. Now, this patient needs a temporary pacemaking, and then if it is needed, then permanent pacemaker will be implanted. Polyneuropathies, I said that it is not very common. It's primary infection, parallel the onset of the primary infection, multiphasic in onset, time period 2 to 3 weeks, the palatal and the pharyngeal paralysis. It means that it is vagus nerves which is involved, 9th, 10th and 11th nerve, basically. That is called pharyngeal plexus. And 5th week, the cranial neuropathies, 3rd nerve, 7th nerve, it will be involved. But after the 10 days to 3 months afterwards, this called, you have read, I think read in the in cases of neurology, that it can cause the delayed polyneuropathy. Now, diphtheria skin lesion is like this. Look, this is a very very closely as a fungal infection, tinea. You see, this is a center which is necrosis, bleeding comes out in the center, around there is paleness, redness, and there is a border, definite border is seen in this case. Involvement here is also. Now, croup is very important. In this disease is famous for its croup, stridor. The laryngeal diphtheria can lead to the cleft swollen neck and a throat with bull neck because of the very large lymph nodes. The swollen throat is often accompanied by a serious respiratory condition characterized by the brassy, because the epiglottis is involved and involved. The coughing is like a barking cough, and a whoop. I already said the barking type of cough, just like a bark of a dog, and stridor means croup. Croup means that it is definitely is a continuous sound which is coming in inspiration and expiration. Hoarseness, difficulty in breathing, historically referred to variously as diphtheritic croup, true croup, or simplifies as croup. Diphtheric croup is extremely rare in countries where the diphtheria vaccination is customary. So in our country, we call diphtheria vaccination is going on to At the time in 1974-75, I have seen croup in children, but afterwards I have not seen any croup in the children. I have seen the barking cough because of the epiglottitis, which is caused by the another virus, not viral, it is a viral croup, not the diphtheria croup. Seen many cases of it, but not diphtheria croup. Nowadays, most often refers to an unrelated viral illness that produces similar but mild suspicious symptoms. Rhinoviruses can cause it, yes. Moraxella can cause it. The epiglottitis, parainfluenza virus. These are the viruses, a group of viruses which can cause epiglottitis. And epiglottitis is a very serious condition. One should take it very seriously because it will cause the strangulation and it will cause the severe respiratory acidosis. And it will cause the type 2 respiratory failure, and the patient should go to definitely on ventilation. Diagnosis you can do by the laboratory data, the clinical features associated. Gram stone throat culture, you can go the blood culture, you go for the other culture as well. The skin, by histopathologically diagnosed diphtheria by Albert's stain, specific stain is used other than Gram is Albert's. Toxin demonstration you can give. Yes, ELISA can cause, nowadays the ELISA PCR can be done other than the clinical criteria which I have given. So these are the laboratory. The blood CBC will cause the neutrophil, rather the lymphocytosis basically, and it is the ESR is raised. You go for the CRP, it is raised, and then you go for the culture is concerned, throat swab or nasal swab or a throat swab. The culture, you will see under the microscope by Albert stain, the club-shaped type of the Cornybacterium. Or if you will go for the Localisation medium, you can culture it after, culture come after 7 to 8 days. Quick diagnosis can be done by clinical, which I have said already, shared with you, or rather the direct evidence. Gel precipitation tests are now today we are doing PCR, ELISA. These are the two tests which are costly, but they can be done immediately to diagnose this condition. Otherwise, you have to get the other ECG and you go for the nerves conduction studies, for the polyneuropathies is concerned, etc., etc. Can be done. The treatment in this case is this. If there is the lymph node, if there is swelling, first of all, you give the steroids to reduce the swelling, and if it is the patient is very, very, breathlessness, and your chances is there is a detachment of the membrane of the child, you go for intubation of tracheostomy to save this child. Otherwise, you go to type 2 respiratory failure. It is called the paralysis of the eye, the neck, the throat, respiratory muscles. It can cause. In this condition, you have to go intensive care unit. You have to give the ventilation, ventilators. You have to use the ventilators to save this patient. But given the anti-diphtheric serum, which is available from the horse serum, and have been challenged with the diphtheria toxin. This is direct and immediate management along with the steroids to reduce the toxicity of the problem. Since antitoxin not neutralize the toxin that is already bound to the tissues, if it is bound, so anti-diphtheria will not act. Delaying its administration increases risk of death. You have to give ADS as soon as possible. First time you detect it, give the steroids and the ADS. Now antibiotics have been demonstrated to affect it is the gram-positive bacteria, because gram-positive bacteria are sensitive to the penicillin group, protein penicillin or other penicillins. If it is sensitive, if the patient is not, it is allergic, then you give the macrolides, erythromycin, clarithromycin, now azithromycin. Metronidazole will also be very good for this condition, although it is mentioned it is important for the anaerobic bacteria. But you combine with the macrolides with the metronidazole nowadays, along with the dexamethasone, to improve the condition. Other than there is, intensive care management, which I have already discussed. Prevention is better than cure. A vaccination program is going on. Diphtheria, pertussis, tetanus. So, diphtheria will cause the problem which I said is the croup, and Bordetella pertussis, which is gram-negative bacillus, I would call pertussis, tetanus. Pentavalent vaccines which vaccinate against it means it will also polyvalent vaccines which we are using here, and for other childhood diseases. For example, you add with tuberculosis vaccine, and you add with BCG vaccine with OPV, oral polio vaccine. And 3 diseases are this, and 2 diseases are other diseases. The 5 vaccines are there. Are frequently used in EPI program, which is launched by the UNICEF. Properly given on the time will prevent the disease. Now this is localized infection, which I said the Cornybacterium minutismum, erythema, on the face, on the skin folds, intertrigos is a common one. So you please try to remember this Cornybacterium minutismum, causing these intertrigos or its localized, inflammation under the fold of the skin. They are important. Cornybacterium minutismum. Just to repeating because they are coming in the MRCP examinations, and that is why I am repeating it. And another Cornybacterium urulaticum, for the nephrologists this is important. Now, Cornybacterium urulaticum is an opportunistic nosocomial pathogen causing the mainly acute cystitis, pyelonephritis, alkaline encrusted cystitis, and encrusted pyelitis. Crusts are formed and may cause bacteremia, mainly in the patient with the chronic urological diseases. Manipulation are there with the tools. You are using the catheters and other things. It can cause, because it is around the genital area as a commensal, it will go inside and become pathogenic. It can cause the cystitis, and it can cause the pyelonephritis and so on. The Cornybacterium urulaticum is another species which is important. I am thankful that you have listened it and tolerate me for more than 40 minutes. But it is important for everybody. I hope you have enjoyed it. If you like it, please subscribe this free channel and like it if you like it. Assalamu alaikum wa rahmatullah.